Afternoon, everybody. Thanks for making yourselves available at short notice and coming up to the Ministry of Health. So as I think at least one news outlet is already running, just wanted to confirm for you that we've identified our first case of the Omicron variant in New Zealand. This is a person who is in managed isolation in Christchurch. The person arrived in New Zealand on a flight from Germany via Dubai. That landed in Auckland, and then the people on that flight were transferred to Christchurch on a chartered domestic flight with all our usual protocols, and all the people on that flight are in two separate hotels in Christchurch. This person was tested on day one. The positive test result on day two was reported. That was on the 12th, and actually the case was reported on the 13th in our numbers as a case that had come from the border. There's one other case that has already been confirmed from that flight on day 01 testing, but the whole genome sequencing on that other case shows it's Delta strain. So we're doing urgent whole genome sequencing on all our cases at the border, and we fully expected we would find a case of Omicron, and in fact we are treating every border-related case as if it were Omicron until proven otherwise. So saying, we have good protocols in place that are designed to stop the virus getting across the border. They've served us incredibly well with what we know is already a transmissible variant, that's Delta, and the team has had a very good look at our protocols over this last week. The one change we have made is that if there is an Omicron variant case at the border, then everybody who is on that flight is considered a close contact. That's on both the international flight and the domestic flight as well. And everyone on the floor of the hotel where they are staying is considered a close contact, and they complete their full 10 days in the managed isolation facility at this point. While we just await further data about Omicron, that's our interim approach, and that is the approach we are taking in this case. So that's really all the information I have available at the moment, but I'm open to questions, and I've got other information I haven't yet disclosed. I will happily do so.
We know how Delta got into the community, that jump over a fence. What precautions are in place?
Yes, so obviously our very good infection prevention control protocols that are in place, the regular testing, which is still day 1, 3, 6, and for those people who are staying on for their full 10 days, they will have their day 9 test in MIQ and will need that result back before they can go. And this case will stay for a full 14 days in MIQ. So again, that's part of our new protocol. Oh. So we've had hundreds of highly transmissible Delta cases in MIQ through, and we've had just the one that's jumped the border. So we have every intention of keeping Omicron out of the country for as long as possible.
Are we prepared for Omicron?
I think we're very well prepared, as I've said, and even every time we get a case like we did have that did cross the border back in August, we review all our protocols. We still do the regular auditing. The staff, as you well know, are highly trained, and the infection prevention protocols are there and in place. And in addition, we've put in place just these additional interim measures to really just, while we find out more about this variant, which the information is coming through every day, we will know a lot more even in a week or two, just to put that extra safety net of ensuring that all the close contacts do that full 10 days in managed isolation.
And are other people in the MIQ where this has been found at risk, given how transmissible this variant is?
Well, with those protocols in place, the IPC protocols, and really strict, and particularly we still have that the part of that protocol is that people can't leave their room until that day 01 test result is back. And so as soon as this person's came back positive, they were moved into a quarantine facility. So we think there's very, very little risk to others in the MIQ facility, both staff and people who are staying there.
So are you taking additional measures to testing staff or bus drivers, or trying to make sure that you're wrapping around any possible spread?
Yes, well, there are already protocols in place, but in this case we are contact tracing, and it's quite easy that the crew on the charter flight, of course, working with Air New Zealand. Likewise, the person who drove the bus to take this person and others into their hotels, and the team at Canterbury, the Public Health Unit, is looking at this, probably some additional testing of staff who are working in that facility, just to be sure.
And can you be
Which is
specific?
really
Can you be
nice.
specific? Can you be specific about which hotels it is in Christchurch?
I don't actually know the name of the hotel, so I can't say, but the person's now been moved from the managed isolation facility to a different facility which has a quarantine wing, and I can't just remember the names of them off the top of my head.
Do you know if the PCR test result that they returned had that S gene dropout that we've seen with Omicron, and is that something that the ministry is using to try and monitor for Omicron and MIQ before the sequencing comes in?
Yes. Well, actually, the answer is no. It didn't. We don't know if it had the S gene dropout because we have a number of different platforms we use for PCR testing, and it's only one of those, the Thermo Fisher platform, which is used in Dunedin, which actually looks for the S gene, and so most of our testing here is not looking for the S gene. It overseas suggests that that S gene dropout is not particularly reliable, and so it's not necessarily a marker of it being Omicron. We do the urgent whole genome sequencing anyway, and treat them all as if they were Omicron, which is I think the best thing we could be doing.
Would you look to change that PCR testing done elsewhere in the country to look for the S gene?
Not at this stage. No.
If Omicron is found in the community, would you recommend more lockdowns to Cabinet?
We just have to see what the situation was actually, because we've got to remember, even when we got this Delta incursion back in August, our vaccination rate was a lot lower, and we can see the impact that the vaccination rate is having on the spread of the virus in the community. What we're intent to do is, of course, give ourselves as much time as possible to learn from the rapidly emerging evidence, particularly in Australia, which is in a similar situation to us from a seasonal perspective. It's summer, but also just to see what the spread is of the Omicron variant there compared with the parallel Delta spread. And that's going to be really, I think, useful in terms of decision making about what we might do if we do find an Omicron case in the community.
So what is this trigger? Are we going to see boosters rolled out faster? What sort of things has this triggered?
Yes, one of the things we've already been looking at, and we've seen other countries already move in this regard, the UK with a very large outbreak that's growing by the day, as we know, have moved that interval between second and third dose, or second and booster dose, to 3 months, Australia down to 5 months. I've got some advice that I received just yesterday on this, and we're discussing it with ministers tomorrow to look at see if the advice is to reduce our interval down here. Question here, and then I'll come back to you.
Do you know the vaccine status of this person, also if they're sharing a room in isolation with those?
I don't know if they're sharing a room. However, yes, this person was double vaccinated with the Pfizer vaccine.
And so, given that, are you reconsidering at all the at-home isolation trials at the moment, given the risk that Omicron poses?
Not at this point, and it's not so much a trial as that's the approach we're taking now. One of the things that will be material in terms of any decisions or changes there are that one of the things that will be material in terms of any changes to our current approach, which is 7 days managed isolation and 3 in self-isolation at home, will be emerging evidence about the incubation period and how early people start to show symptoms. And it seems from the early evidence, and as you would expect, that the incubation period is even shorter than Delta, which was shorter than previous variants. That would make sense, in which case we would be probably even more confident we would be picking these cases up during the 7 days they were in managed isolation, and particularly given there's still day 0, 1, day 3 and day 6 testing. Okay, the case is now in the Sedema, I can tell you, and I think that was also just 1 or 2 minutes left. Question here.
Given the surge number of cases overall in the UK and the number of Omicron cases in the UK, are you close to designating it a high risk, very high risk country?
So we've just today the teams looked at the very high risk categorisation of countries, and when the Omicron was first discovered, a number of southern African countries were classified as a sort of an initial response as very high risk. Our sense now is that that's not particularly helpful because Omicron is everywhere really, and as you've said, particularly high rates in European countries. The ones that are doing a lot of genome sequencing are finding high numbers, and it's almost certainly at similar rates in other countries. So it's in this sense we don't think that the very high risk categorisation is particularly helpful in terms of determining whether countries should or shouldn't have different approaches when people come here. So we'll just probably move to a similar approach to all countries.
Dr. Bloomfield,
yeah,
sorry,
please.
what's your message to Cantabrians who are about to go on Christmas break?
Well, my message is the same as it is for all Kiwis, and that is make sure you're vaccinated, mask, scan, pass, and just keep vigilant. The key point, and I just want to emphasise this again, is this person is in managed isolation, as are all the close contacts who were on the flight. So this is not a case that's out in the community. So if you're unwell, of course, get a test. But in the meantime, there's no particular additional risk to Cantabrians at the moment.
Can I just ask quickly, what's on the concern that Omicron poses, if and when it comes to New Zealand? I mean, we've seen an extremely high daily case rate in New South Wales today, but there seems to be evidence suggesting it's not as problematic as Delta, in terms of severity. Does it still pose a substantial risk, though?
So 2 comments there. First of all, it will be interesting to see just what is driving the big outbreak in New South Wales. There's no doubt where they've found Omicron, there are quite high numbers associated with particular outbreaks, say in hospitality establishments. And we can see this in Europe in a couple of countries where they've done the sequencing as well. So, but it will be interesting to see how much of that New South Wales outbreak is just driven by their existing Delta outbreak and the sort of them taking the handbrake off any of their restrictions and the large gatherings and interactions that were happening, and that could be driving it as much as the Omicron is. The issue around whether the virus is more or less virulent and causes people to get more or less unwell, there are 2 things, of course, that are important there. One is not just the rate of, say, severe illness and hospitalisation, even if that is lower. If it is much more transmissible and the number of cases is much higher, that will still drive more hospital admissions and potentially deaths. And so we will be looking, as I've said, very closely at the emerging evidence on this over the next 1 to 2 weeks. I think we will start to see that appear, and that will give us a good picture then about just what we would want to do if we found Omicron in the community here. 2 more questions.
Just back to lockdown. So if Omicron is found in the community, you're not ruling out recommending more lockdowns?
Well, what I would say is even under the current framework, there is a provision for local restrictions or lockdowns. And so whether it's Omicron or Delta, that's available there as a response if there is an outbreak where we think that might be necessary to help get control and reduce the impact, particularly on health services. So again, it's probably doesn't matter if it's Delta or Omicron, but at this point in time, we're intent on keeping Omicron out of the community.
What more can you tell us about the case? Are they a returning resident? Are they here for a sporting team? What do we know about them?
The only, well, in response to those two questions, this is someone who's usually resident in Germany. I'm not sure of whether they're a New Zealand resident or citizen. I don't have that information to hand. They're not here as part of a sporting team, but that's about all I can offer.
What's the
Final question?
Tell us about how effective the vaccine is against Omicron.
So I think we're seeing some rapidly emerging information here from the initial studies that Pfizer did, which were in the lab, and then some data that's come out of the UK suggesting that 2 doses, and we're talking here about what we're comparing as symptomatic illness, 2 doses of Pfizer seems to be about probably 40% effective at preventing symptomatic illness, but that 3rd booster dose puts that back up between 80 and 90%, and that's that's good news because this is a good vaccine. It's the vaccine we're using. We've started our booster program and we've got our booster doses arriving over coming months. The question will be just, should we shorten that interval between the 2nd and 3rd dose? And as I say, we're providing advice to ministers who will be considering this tomorrow.
Could you just confirm that advice would be to 4.5 months, 4.5 months?
Well, we'll look at options there. It would be something less than 6 and more than 0. Okay, thanks very much. Have a good Christmas.